Hello, I'm Francis Camilo Espolo, a BSN student from the Visayas State University. Today, I am going to demonstrate how a nurse assists and handle during fetal labor and delivery. Nurses play a crucial role during labor and delivery because they are the ones who monitor the vital signs of the mother and the baby. Nurses also monitor the complications that happen during the process and provide accurate information to the doctors and residents in charge.
Now we are going to prepare the personal protective equipments that we are going to use. The OR gown, mask, cap, surgical gloves, blanket, sterile towel, bonnet, forceps, scissors, vitamin K, Hep B vaccine, syringes, oxytocin for mother, and gauze. Perform hand washing following the 1, 2, 3, 4, 5 counts in each movement to prevent the spread of infection. Don mask and cap.
Good day, ma'am. I am Francis Camilo Espolo. I will be your nurse for today. So, is your name Ninita Polo?
Yes,
And when is your birthday?
February 5, 1967.
Okay. So I will be your assisting nurse before, during, and after. And how are you feeling today?
Fine.
Is your position okay?
Yes.
So I'm gonna go prepare for your delivery and I'll be right back in a bit.
We are going to prepare the place of birth, place the instruments near the delivery table, and don 2 sets of gloves.
Okay, ma'am, we're going to put you in a lithotomy position. Raise both your legs, and then going to put here. Okay, ma'am, we're going to push in a count of 3. 1, 2, 3, push!
When the head is crowning, instruct the mother to do spontaneous pushing during contraction. Assist the mother during delivery by coaching to push effectively and instructing her to avoid Valsalva maneuver, and teaching 2 methods of pushing such as urge to push and glottis pushing. Also instruct the mother to push 3 to 5 times with each contraction, or to grasp below the knees or other hard objects as he bears down. The nurse could advise the woman to pant during some contraction and let her breathe through paper bag or cupped hands. Deliver the head of the baby slowly by performing Ritgen's maneuver while delivering the head. Place a sterile towel over the rectum and apply forward pressure on the fetal chin, while the other hand presses downward on the occiput, or depending on hospital policy. After delivery of the head, insert fingers in the vagina to check for the cord in the fetal neck. Since it is absent, deliver the fetal body holding the sides of the head with two hands. Then apply a slight downward push to deliver the anterior shoulder. Then elevate the head to deliver the posterior shoulder. Then the rest of the body follows without difficulty.
Ma'am, it's a boy at 6:35 p.m.
After the delivery of the head, wipe the secretions from the mouth and nose of the new baby. This is to remove the secretions and establish airways. Do not wipe off the vernix caseosa, which serves as the natural protective cover of the baby and insulator. Dry the baby within the first 30 seconds using the first linen while stimulating to cry. Stimulate baby to cry if baby does not cry spontaneously or if the baby's cry is weak. Do not wash the baby within the first 6 hours of life as it can lead to hypothermia and infection. Carry out a rapid assessment of the baby. Perform rapid assessment of the newborn's respirations or APGAR while drying the baby. Remove the wet linen and initiate skin-to-skin contact by placing the baby prone in the mother's abdomen or in between breasts. Use the second linen to cover the baby's back. Place the bonnet to cover the head of the baby. Remove the first set of gloves prior to handling the umbilical cord. Hold the cord and allow pulsation to stop before clamping to prevent anemia and to prevent preterm babies from intraventricular hemorrhage. Apply the cord clamp about 2 cm from the base of the umbilicus. Then, apply the second clamp about 5 cm from the base of the umbilicus. Lastly, cut the cord at least 1 cm from the cord clamp. The assisting nurse will inject oxytocin to the deltoid muscle of the mother to prevent uterine atony. The handling nurse will wait for signs of placental separation like Calkin signs, sudden gush of blood, lengthening of the cord, and appearance of the placenta in the vaginal opening. If sign of placental separation is present, then deliver the placenta. Call for the time of the delivery of the placenta and check for completeness of the cotyledons. Then massage the uterus to promote uterine contraction, thus preventing hemorrhage. Check mother for presence of laceration in the cervix, vagina, and perineum, and prepare to assist doctor for suturing. Check the mother's condition and vital signs. Clean the mother and keep her comfortable. And lastly, do aftercare. Now document the findings. The time of delivery of the baby, sex of the baby, position and presentation of the baby, Apgar score of the baby, medications given to the baby, time of the delivery of the placenta, if the placenta is delivered complete and intact or in fragments, method of delivery of the placenta, mechanism of separation, time, amount, route, and administration of oxytocin, condition of the mother including vital signs, and perineal laceration or episiotomy and repair. Wash hands aseptically. Don mask and cap. Check the functionality of lights, delivery table, oxygen apparatus, suction apparatus, and emergency cart. Gather the supplies and equipments needed. Cover Mayo table with sterile sheet. Politely greet the patient and introduce yourself, and provide a brief orientation related to labor and delivery room policies. Transfer the client safely from stretcher to DR table. Assist client in lithotomy position. Skillfully perform perineal wash. Pour water on thighs and mons pubis. Carefully shave perineum following the coarse hair growth. Rinse the perineum with water. Disinfect the perineum with one stroke from inner to outer thighs, mons pubis to symphysis pubis, labia majora to minora, clitoris, urethral orifice, vagina, and anus. Inform client before pouring water for rinsing. Record the time when the membrane ruptured as observed, the time of delivery and gender of the newborn, the time of placental expulsion accurately. Administer safely and accurately oxytocin after obtaining the blood pressure of the client. When assisting for episiotomy, disinfect the bottle of lidocaine, position correctly the lidocaine bottle for extraction. Also provide additional cotton balls for disinfecting incision slip. Provide additional suture needle and other materials needed. Document accurately in changing client's clothing and transfers client safely and secure the client from the delivery room table to the stretcher. Lastly, maintain ethical standards with or without the presence of authority.